We have a 60-year-old woman with a history of several years of pain in her left shoulder when hanging out washing and raising the arm above the head away from the body. After a recent lifting strain, the pain became acutely much worse, and she said she is now unable to lift the arm up at all. The illustration shows her trying actively to abduct the arm and represents the limit of her movement. On palpation, her deltoid muscle is actively contracting. The arm can be moved passively to full abduction. Which one of the following is most likely diagnosis? Is it A, exacerbation of glenohumeral arthritis, B, adhesive capsulitis or frozen shoulder, C, rupture of supraspinatus tendon, D, dislocated acromioclavicular joint, or E, osteoporotic fracture of the surgical neck of the humerus. So the explanation here, an acutely torn rotator cuff mechanism or complete rupture of the supraspinatus component results in the inability to abduct the arm more than about 40 degrees in the presence of an acutely contracting deltoid muscle, which is illustrated here. And so the answer is C. Acute spontaneous rupture rarely occurs in a previously normal tendon and usually follows previous age-related or occupational degenerative change, particularly affecting the supraspinatus component. The supraspinatus tendon has a major role in maintaining glenohumeral opposition during abduction, particularly in the coronal plane and assisted by the actions of the deltoid and other muscles. When the tendon suffers acute rupture, active abduction cannot be initiated despite deltoid function, but if the movement is initially assisted, the deltoid can subsequently continue abduction of the arm above the head. A normal rotator cuff is unlikely to rupture, but previous symptoms of tendonitis may not necessarily precede the acute episode in response to an excessive lifting strain. Glenohumeral arthritis, adhesive capsulitis or frozen shoulder, and fractured surgical neck of the humerus give global painful restriction of movement. Dislocated acromioclavicular joint gives a characteristic step deformity of the prominence of the shoulder.